Everyone. Myself, Ms. Rosemary George, Professor at Parul Institute of Nursing, Parul University, Vadodara. So today we are having a webinar session with the topic Prevention of Elderly Abuse. So this is a very significant topic in the present times. And as per the WHO statistics, around 1 in 6 people who are 60 years and older experience some form of abuse in community settings during the past year. And rates of elderly abuse are found to be very high, especially in institutions such as nursing homes and long-term care facilities. So even during the COVID-19 pandemic, that time the rates of elderly abuse have much increased. So elderly abuse can lead to serious physical injuries and long-term psychological consequences. So elder abuse is predicted to increase as many countries are experiencing rapidly aging populations. And the global population of people who are aged 60 years and older will more than double from 900 million in the year 2015 to about 2 billion in the year 2050. So this prevention of elderly abuse is one of the significant emerging topics of the current times. So for elaborating on this topic, we have an experienced resource person amongst us. I'm very happy and glad to welcome Ms. Shanu Mehna ma'am for being the resource person for this webinar. So giving a brief introduction about ma'am. Ma'am is presently working at VMMC and Safdarjung Hospital as a CNE coordinator and senior nursing officer. And she is also the nodal officer of biomedical waste management and NABH pre-entry level assessor of HCO. Ma'am is a core quality team member in the quality cell of Safdarjung Hospital, New Delhi, and core quality member of Nursing Excellence Management Committee of Safdarjung Hospital. Ma'am has a total of 28 years of experience in clinical as well as in teaching, and she has served as resource person in various workshops, conferences, and webinars. And Shanu ma'am has been the national level trainer for nationwide training of nurses for capacity building for management of COVID-19 pandemic and preparedness of nursing professional against the third wave. And she also has been a trainer of capacity building program and training of nurses regarding prevention of elder abuse and management. Shanu ma'am is currently doing PhD nursing, and she has also completed the MSc nursing in the specialty of medical surgical nursing and also completed MA in sociology. Ma'am has also received the best thesis award in Master of Nursing for securing the first prize in dissertation. So with this brief introduction, I would like to invite ma'am Hartley to kindly take over the session. Over to you, ma'am.
Thank you, Rose. Thank you so much for the lovely introduction. And first of all, I'm highly privileged to have this session on elderly abuse management and prevention. And I am really highly obliged that the Parul University has given me an opportunity to share the experience and share the elder abuse management prevention, how we as a nurses can contribute to have the elder abuse prevention management and to identify the cases and to provide the various types of the care to the clients, right? So that the reporting should be done in the elder abuse management programs. So with this, I'm really again thankful for all the organizers, moderator Mrs. Rosemary George, and the special team from the Parul University Vadodara. So now I will have shall I share the slides, Rose?
Yeah, sure.
Okay.
Sure.
So is it visible?
Yes.
Okay. So, prevention of the elder abuse and the nursing perspective, they have given me the topic. Though it is a very big topic, but still I'm trying to compile it in a very short forms. So, first, as the Rose has said, like there is a lot of elder abuse in the previous years, especially in the period of the COVID 19. So, with starting with the trees grow stronger over the years, rivers are wider. Likewise, with age, human being gains immeasurable depth and breadth of the experience and wisdom. That is why older persons should not be only respected and revered; they should be utilized as a rich resource to the society that they are. This is the saying by the United Nations ex-Secretary General Kofi Annan. And love, care, and respect will give them the dignity and the better life. So, elder abuse is any type of infliction of harm on an older person in any kind of form, right? It is an any act or failure to act that endangers the health or well-being of the older persons. Such action or inaction is especially harmful when it occurs within a relationship when there is an expectation of trust. And the elder abuse is occurring where there is a break of the they people are believing that the person is there to care them, but it is most of the time it has been seen that mostly the perpetrators, the abuser is from the family itself. So that is the most pitiful condition for the person who is facing such situations. So, elder abuse is any knowing, intentional, or negligent act by a caregiver or any other person that causes harm or a serious risk of harm to a vulnerable adult. So, you can see the iceberg. Iceberg theory of the elder abuse says only 1 out of 6 cases are reported, right? So, unaware, unspoken, that is
Excuse me, ma'am.
unrecognized. Yes,
Uh, the
yes, please.
slide is not moving, I think.
Sides are not moving.
Yeah,
So
it's
shall
still on the
I
first
share
slide.
again?
Yeah,
Okay. Shall I stop and share again?
yeah, you can share again, ma'am.
Okay. Is it visible now?
Yeah, it's visible.
Okay. And just to see whether it is moving. Now you can able to see next slide. Rose.
It's showing elder abuse is that slide we are able to see.
Okay. Next slide. Key facts. I have changed the slide of the next one. Whether you can able to see or not.
No.
No. Okay. So can I continue? Now
Okay,
you can
now
able to
now
see.
now I can see. Yeah, key facts.
So I will not go through the slide share then. Is it
No, it's
okay?
okay. I think now it will be changing. Just click
It
on
will
the
be
next slide,
changing.
ma'am. Yeah, yeah,
This
yeah.
is
Now
not
it's
the
moving.
slide share mode. I'm not playing the slide share mode. You can able to see?
Yeah, yeah. Able to see.
Is it moving?
You
Okay.
can just click on the next slide, ma'am. No problem.
Okay, fine. So you can see the iceberg that only 1 out of 6 cases are reported. Reported is like unaware hai, then unspoken, unrecognized, that means untreated, right? We can't able to treat the clients. So, as the Rose has said, the key facts about the elder abuse, she already has told that rate of the elder abuse have increased during the COVID-19 pandemics, and the global population of people aged 60 years and older will more than the double from 900 million in 2015 to about 2 million in 2050. So, you can see the scenario how increasingly the rates are going on. So most of the 58% of elder experienced abuse in Madurai, and 61% of them live with the family itself. And the form of abuse they are facing are the disrespect 55% carries, and 39% of people have faced the verbal abuse, and 23% people have faced the economic exploitations. And maintaining the confidentiality of family matters, that is the main reason for 45% of elders that they are not reporting the abuse, because sometimes they feel that if they are reporting, it is their fault, or if they are reporting, they are breaking the confidentiality in the family itself. So it is a shame and stigma attached, that how the other people, how the community will respond, how the society will respond to that. That is the main reason that they are not able to report the cases. So 23% of elders did not report abuse as they did not know how to deal with the problem. And moreover, many people are not aware whether it is abuse or whether they are facing like just a simple talk that people are having in the family. So elderly in distress, 73% of Indian youth admit that elder abuse exists. This is the posters showing the from the Helpage India, and the 53% main reasons are property and inheritance disputes are over there, where the elders are not able to cope up, or the people in the family members are not being cope up. Property and inheritance disputes are there, and main abusers 61% are the daughter-in-law and the son. And the form of abuse, most of the time the verbal, they are feeling neglect, physical attacks are over there. These are the salient findings of the elder abuse and crime in India as reported by the Helpage India. So most verbal abuse reported more in Delhi NCR, followed by Mumbai, Hyderabad and Bangalore. And Bangalore tops the elder abuse cases with 44%, with Chennai being last at 2% only. And 98% elderly reported the cases, and they can have the complaint against abuse phase. And 81% elderlies are financially dependent on their sons, and 14% on their daughters. And 60% elderly consider the verbal abuse as elder abuse. Right. So overall incidents you have seen, and neglect constitutes around 45.21%. And most common perpetrators of violence within and outside the family were verbal abuse. Most of the time they are yelling at the elders due to any reasons. Maybe they are in stress, or they are not being able to cope up with the situations, that they can take care of their elders in a proper way. And physical abuse, they are facing 45% outside the family, not only in the society but in the institutions also. This data shows the elder abuse in community settings, what type of abuse and reported by the older adults, and elder abuse in institutional settings. Elder abuse is not only in the community, in the society, but sometimes it is in institutions also, like by the healthcare providers also, sometimes it is reported. And type of abuse, overall prevalence is reported by older abuse in communities 15.7%, but in the institutional settings there is not enough data. And the abuse reported by staff is 64.2%, or 2 in 3 staff they can report the abuse. Psychological abuse in the community setting is 11.6%, as in the institutional setting you can able to see it is high, that is 33.4%, and only the 32.5% is reported by staff. Same with the physical abuse, 2.6% in the community settings, and the reported by the older adults or the proxies 14.1%, and reported by the staff is 9.3%. And financial abuse 6.8%, which is reported in the institutional setting is a 13.8%, but reported not by the staff is there is not enough data showing the reporting is done by the staff. Neglect constitutes around 4.2% in community settings and 11.6% in the institutional settings. And the sexual abuse is 0.9% in the community settings, and same in the elder abuse in institutional settings also. In Delhi, half of the elderly, 50% reportedly experience the abuse. And nowadays, you must have seen in the newspapers also, now and then, every time the news are coming that they have abandoned their parents, they have not keeping their parents in an appropriate manners. And 48% males and 53% females reported personal experience of the abuse, which is 41% have the verbal abuse. Disrespect is the 33%, and neglect is the 29%, that are ranked as the most common types of abuse experienced by the elderly. And the topmost perpetrators identified are the daughter-in-law 61%, and son are the 59%. These are the slides showing the risk factor for the elder abuse. So risk factors like associated with elder abuse, risk factors not only with the only the sometimes the elder only, and the caregiver is also, and the environment in which they are sharing in the living situation, they are living in with the families, or there is overcrowding in the family, they don't have separate rooms to share, and the lack of family support, institutional where they have the poor working conditions, inadequate training of or the supervision by the staff, where they have the low wages. So that's why sometimes they have the, like, healthcare workers are also sometimes in stress, so they expose this stress to the elder only. And low staff to patient ratio where there's a heavy crowds, so sometimes the in institutions this type of abuse also will be there. And in the caregiver, like sometimes the caregiver himself is a uh, abused failed face abuse by their parents in their childhood. So now when they have to take care of the elders, sometimes they have to be they have abused their parents, because this abuse they have seen in their childhood itself. So sometimes the caregiver is suffering from the some mental illness or financial dependence on the elder, and the long duration they are taking care of their elder from the long time, and they are facing a lot of issues, they are not taking care of their family. So this time the this type of abuse also, this is also one of the risk factor that they are abusing their elders. So individual himself, like they have the physical or functional impairments, financial dependence on the caregiver, they have the low social support, and females or the widowhood and the advanced stage, and they are facing sometimes they are not being able to control the, they have the incontinence of the bowel bladders, history of the family violence. So this is also one of the factors. So the type of abuse, if we say the what type of abuse are over there, like some there's the physical abuse, psychological or emotional abuse, financial abuse, sexual neglect, abandonment, and the social abuse. Physical abuse is the use of the physical force, or they may cause a non-accidental physical pain. And psychological, we will see in the next slides how you can assess the physical abuse. Psychological abuse, infliction of mental or anguish pain or distress upon another person, right? Social isolation, humiliating statements, the financial improper exploitation or use of the funds or the resources, and theft or the coercion to deprive the older person of his or her exit. The caregiver can have the all the account details. They are not giving the details to the improper use of the bankings. And the sexual abuse, like non-consensual contact of any kind, like suggestive talks or the forced sexual activity, touching or the fondling. And neglect is the intentional or unintentional failure to meet the older person needs, the failure to provide the adequate food, adequate clothing as per the seasons, shelter or the medical care to the elders, or the hygiene, they are not being able to provide the personal hygiene, or the social stimulations, not allowing the other people to meet with their elders. And the social abuse, that is the intentional prevention from having the social contacts with the family or the friends. And this also have the effects of hiding abuse from the others. So abandonment is the desertion of an older person by an individual who has physical custody of the elder, or by a person who has assumed responsibility for providing care to the elder. And self neglects, like sometimes the behavior of elderlies that threaten the elder's health or the safety. So where the nursing roles are aware, but the perspectives of the nurses, that what signs when they face in the casualty or in the emergency rooms, when the people comes, elder comes, so how they can look whether the person is facing the elder physical abuse, in because no elders saying that they are facing the elder abuse, because sometimes when they are brought in the emergency situations in emergency rooms, they are being accompanied with the relatives or with the caregivers who are the caregivers with them. So we have to look for the physical signs to identify whether the person is facing the abuse or not, right? So physical injuries like bruises, any scratches, we can look on the face, arms, legs, and broken bones or sprains, frequent fractures like repeated fractures, cast. We can ask what type of injury it is, or where person is having difficulty moving or handling the objects. Sometimes they have the circular burns. You can able to see in the pics also circular burns are over there. Cigarette burns or the redness or scalding of the skin, especially on the back or the bottom of the legs, buttocks or the back of the arms. So these type of the same things we can see. And signs of the scalding from overly hot waters, right? If the person is not been having the specs, so they can have the falls. You can able to see the cuts on the elbows, right? So another physical signs to look for the ligature marks on the wrist area, ankles, or around the waist. So evidence of the restraints. These are the suggestive of the evidence of the restraints that they may be at home. They may be physically restrained by their caregivers. So signs of malnutrition or dehydration. So ask about the breakfast or the lunch, whether they had their breakfast, whether they are been providing with the appropriate lunch, what in the morning, what they had in the morning. So this type of things, look for the water or other drinks, like they are taking enough amount of food, enough amount of water, or the dehydration, whether they are suffering with the dehydration or not. So this suggestive or the consequence loss of weight, right? Weight loss or significant gain, that clothes that don't fit them. So repeated injuries, we can ask about the injuries, how the injuries has occurred. So sometimes they give no, it is my fault because of vision problems, because of my physical problems. I have fell down, or I have there's something sofa was there, so I have stuck with that. So that's why the injury has occurred. Or there's a contradictory statement with the relative. So we can identify easily whether the elders, whether the abuse has been occurred or not, right? So look for the defensive injuries on the back of the patient's dominant hands. This all can be done when the nurse is having the physical assessment of the client. So some skin lesions may resemble the implement used like the shoe or belt buckles or stick when the perpetrator tried to hit the victims. Right. So other physical signs we can look for the over or under medicated, right? Flat or the blunted effects without any explanations. Client having the blood sugar irregularities, they are not been provided the medications. Blood pressure irregulated in spite of prescription of the medications, they are not been providing the medications by the caregivers. So lack of the needed medications or the multiple prescriptions for the pain medications or the anxiety medications or the tranquilizers or broken or missing eyeglasses or the dentures. Most of the times if the glasses have been broken, it takes time because sometimes the caregivers say they have the financial crisis, so they are not being provided with these. So repeated fractures, or sometimes the contradictory statement is that if you ask whether you are using the glasses, you are giving them something to read, they are not being able to read. So they may say that I forgot to bring the glasses. Actually they don't have, sometimes they don't have, sometimes they forget because of their forgetfulness also. So repeated fractures are over there. So how to assess the emotional signs? So frequent emergency room visit, prescriptions from the different doctors, look at the insurance claims, and reluctance to see the medical care for injuries. They are covering up. So as earlier also I have given the examples that if you ask how you fell down, so they may say the covering up, no, it is my fault. I have not able to see some. I just went over there and fell down. It is not anybody's fault. So they covering up the situations. Or the dismissive explanation of injury, such as I must have bumped into the table or he must have walked into the wall. So these type of explanation they are able to give. So refusal by the family or caregiver to allow the person to be alone. Sometimes their caregiver is not allowing the elder to be alone. When you take the history also, they wanted to stay with the patient itself, right? So you need to tackle this situation very carefully. So change in the long-term social interaction like the phone, text message, emails, or the social media. So making it difficult for the person to get out of the situations. They are not being allowed to have the attend the phone calls, even not being allowed to have the provision of the text messages or the mails. They are not being allowed. The all things being covered by their caregivers. So they have the sign of the fear, especially of the particular person. If their son or the daughter-in-law or any other family persons are over there, so they must be fearing. Watch for the facial expressions over here, whether they are being fear, anxious. So physical reaction to the person or the names. No, 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 my son will come. So these type of the statement they can give, or the emotional discomfort with the presence of a person or when talking about a person. We need to watch, observe very carefully that watch the face and the behavior, relaxing when a person leaves the room, when their son or their family members leave the area. So they feel relaxed, and then they can you can approach to the persons, and then they may be free to talk. But sometimes it takes a lot of time to have the freedom, so to make them comfortable. So that's why you need to make the trust, you need to create the trusting situation that they are feeling safe to say about the abuse. So changes in the
Excuse me, ma'am.
clothing or
Ma'am,
yes,
please click on the slide now, current slide, because it's not moving.
is it not moving right now also?
No, 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 no. It is still on that previous slide itself.
Okay, I don't know what happens. I need to stop again.
Yeah, I think
Now you
because
able to see
yeah, yeah.
right now?
Now it is changing. Yeah,
Okay. Now is it able to see?
physical signs.
Okay. I don't know what happens in between. Oh, sorry. Is it visible?
Now it
Hello?
is behavioral or emotional signs.
Now
That
physical
slide.
signs of sexual abuse. Next slide you can able to see.
Uh, Till now we are seeing the same one, behavioral or emotional signs.
Behavioral or emotional signs of sexual abuse.
No, no, not that one.
No, not that one. Okay.
Yeah,
I
yeah.
think
Now it is visible.
now it is visible. Physical
Yeah.
signs.
Yes, yes.
Okay. So we were discussing about the changes in clothing that may suggest the covering up the injuries, like the long sleeves. They are wearing the long sleeves in the season of the summer itself, or the long pants, or they are using scarves when it is a quite hot environment. So with these also you can able to see that they are covering up the injuries by having the covering of the injuries by changing in the clothing patterns, right? So next slide, you can able to see the next slide. So physical signs
Yeah.
of sexual abuse can be like bruises around the breast or the genitals, torn or the bloody clothing or the bedding. So when the housekeeper or the nurses who are caring the client, they are the front line of the observations. So unexplained vaginal or the anal bleeding or repeated STD infections. That is also the physical signs of the sexual abuse. So, behavioral and emotional signs of sexual abuse, like inappropriate interaction between the person and the caregivers, family, or the friends, like the unusual sign of affection, touching, words, using of the words, behavioral change like the withdrawal or the fear. Look for the change, like sudden change in emotional state. They may feel sometimes withdrawn also, or sometimes have aggressive feelings. They may fight back, striking out against everyone, or the person is having the increased shyness around the familiar persons even. So that is also one of the sign of the sexual abuse, or hesitancy about the showering or the bathing. So hiding up, like the covering up with their clothing itself. So, when the person is having withdrawal from the social activities, sometimes they feel depressed. They have the fear of the familiar persons. Even they start mumbling to themselves also. So, all these type of the changes in behavior we can notice. They feel nervous. Sometimes they have the nail biting. So now comes to the science of how we can assess the signs of the neglect in the persons. So if you see that the person is having the dirty or unkempt appearance, excessively worn, or inappropriate seasonal clothing, sudden unexplained weight loss, loss of appetite, dehydration, inappropriate or lack of food in the home, or lack of access to appropriate nutrition, or the untreated illness or the chronic conditions for which they are not getting the medications, or needed or missing the durable medical equipments like the canes or the walkers, wheelchairs, glasses, and missing or the broken eyeglasses, dentures, or the hearing aids. They have the heat exhaustion or the frostbite, having the bed sores. If you physically examine them, they have the bed sores or the soiled diapers. Nobody is there to change their diapers, or the cluttered living environments, insect infestations where they are living conditions, poor living conditions, or the utility disconnects. No, they don't have the excess of the phone calls, even no other social interactions with other people, or the unsafe or the inappropriate housings, or the missing appointments. So, person in need of care, they have left alone for extended period of time or left alone in a public place, right? So these are the signs of the neglect, how we can look for the financial exploitation, like the utility disconnects or asking for help with others, or the missing the financial statements, or misuse of the credit cards, banking activities, unusual banking activities when they are not been able to use, or the moving accounts. They are transferring the accounts. Nowadays you see the so many mobile apps are over there, and many elders are not been able to have those use of the mobile apps. So without the person's knowledge, they can transfer their family members can transfer the money to their accounts. So this is also one of the kind of the financial exploitations. So the use of the ATM cards without knowing the persons, right? So debit card used for shopping without telling them without taking the permission from their elders. So we have seen the how we can assess for the different kinds of the signs to look for the abuse. Now the barriers to older adults reporting the abuse, why they are not being able to report. Sometimes they have the diminished cognitive capacity, or the mental or the physical disability, lack of awareness. They don't feel that whether they are facing the abuse or not, or they start thinking that this is a normal situation. If they have at home they are alone, so they feel that okay, it is a normal for everyone. So they don't, a lack of awareness what constitutes the abuse, or lack of knowledge of their rights and the resources where they can report, or the social isolation or fear of alienation. Sometimes they have fear whether they will, if they will report, they will have to face more abuse, because after all they have to come back to their family itself. So these are the various barriers. Or they need to preserve family relationships, right? They don't want to abandon themselves, or dependency on others in the family. They have the stigma, what the other people will say, what the society will say. Now at the age of this aging process, now they start complaining about their own sons which they have brought up. So these are the stigma associated, or the literacy and the language barriers where they will not able to have the communication, proper communication is not with us, or the fear of reprisal from the perpetrator. So if they report, maybe their reprisal means like they fear of their punishment. So when they came back to the home, so they feel they will face more punishment if they report. So these are the elder abuse management protocols, guidelines for the actions where the nurses are having the great roles, like identify whether the abuse is taking place or not, provide the emotional support, assess the risk and plan the safety, and refer to the appropriate place, and documentation, proper documentation that is most required. So who should do it? The reporting. Like all the professionals, like the medical practitioners, nurses, social workers, lawyers, police officers, they can report. or the staff in residential facilities for older, service centers for older person, or organizations caring for the older person. Many NGOs are caring the older persons, and any member of the public or older person themselves can report. These are the procedures regarding the notification and handling of cases of abuse of older persons, like the identifications. This is a process whereby a member of the public, professionals, or a layperson, in his or her official capacity or otherwise, recognize the neglect, exploitation, ill treatment, or abuse, or has a good reason to suspect that it is occurring or has occurred. So, what should be done? We have to identify the reasonable ground for the belief that abuse is occurring by taking the proper history, establish the wish of the older person and respect the wish, and assess or refer the older person or carer to appropriate resources or professional for assessment. For example, the collection of the forensic evidence, and multidisciplinary interventions are necessary, like the medical practitioners also, psychiatrists also, psychiatrists, police, and the legal laws where they are providing the protection to the elder persons. So identify whether abuse is taking place or not. In circumstances where abuse is suspected, ask the question in a manner to gain more information about the older person situations. Gather the complete information from other resources, if possible, like the from the relatives, friends, or the neighbors or other carers, and consider the including the specific screening questions during the assessments to help identify the sign and symptoms of elder abuse. There are many screening protocols available, tools are available. So initial contacts determine the level and urgency of the safety concerns. So first of all, the safety of the client is utmost important. So determine if the perpetrator still has access to the victim. So whether they can more, they will abuse if they found that this person is reporting the abuse. So identify the risk, that is the life threatening, like the including the risk of the homicide or the suicide tendencies, risk of suicide and self harm, and record the name, last names, first names, address, telephone numbers, home and the work, age of the person, date of birth, and the gender. Where the sexual assault is suspected, encourage the victim to preserve evidence by not changing the clothes, washing, using the bathroom, or the drinking anything, combing hair, or disturbing the scene. So, so provide the emotional support. Listen to the person's story or the person's statements. Acknowledge what they are saying and validate their feelings. So if you listen, active listening should be there, and maintain the calm appearance. Reassure them that it is okay to talk about the situations. And side by side, you have to maintain the confidentiality until unless it is a risk of the harm, right? So, confidentiality means you should not discuss the matter with others. Only the matter should be discussed with the team itself who is treating the client, and accept that they will disclose only what is comfortable, and recognize that talking about abuse is difficult, and let them take their time, and don't make the promises which you cannot keep the promises. So to tell them what you plan to do the next. So all this needs a very calm environment, and confidentiality is at most. Assess the risk, determine the level of urgency of the safety concerns, like the if it is emergency response in life threatening situations where there is an immediate threat to the life or risk of the injury, immediate action is needed. So appropriate emergency services should be provided immediately. If it is urgent, safety of the older person is at most important. Action should be taken as early as possible to safeguard the older person and prevent the further injury or the damage to them. A thorough physical examination is must. How you can assess the physical injuries? Use the standardized assessment tool and gather much information, as much as you can able to have been, but take into account the comfort of the client is should be there. So in non-urgent responses, if there is no immediate threat to safety, then responses will depend upon the situation and the decision making capacity of the older persons. Ensure that any action you take will not increase risk for the older person. For example, providing referral information in written format may escalate the abuse if the perpetrator sees So you need to see the privacy also. Refer the older person to the chief medical officer on duty and gather the decision making capacity informations. Educate and support the older person no matter what their choices are, and always provide contact information for the services, right? So how we can interview the older persons? Confidentiality, I have told you, address, telephone numbers, and record the current use of the medications, whether they are been taking the medications, any medication like the aspirin, NSAIDs, or the anticoagulants, or any hypertensive medications, diabetic medications. So all the things has to be record keepings. So wellness, disease management, what type of diet they are taking, exercise, what type of coping mechanisms they are having, techniques, any use of the psychotropic medications, or the use of alcohol, drugs, how frequently they are using it, amount, any problems associated with the use, what type of sleeping pattern they are following, whether they are following the taking more naps at the daytime, whether they are being able to sleep at night proper or not, how much hours they are able to sleep. So ask the directly. Sometimes we have directly about the abuse. We ask, so you can say the client, because sometimes they feel very awkward situations. So you can say, we ask everyone about abuse in their lives because it is a concern for many people. Is there any person or place in your life that makes you feel unsafe? This type of statement we can always say to the clients. So you can say them that these type of questions we ask to every individual who is entering into the areas in clinics. So document the record keeping, observations, what you observe, record what the older person says or the other witness is saying, and describe any current or the past injuries they are facing, and document what actions you have taken as per the decision making capacities, right? And first and foremost, interventional principles are the do no harm and do not escalate actions, right? Do not assess the safety and risk and implement the safety management plans. But overall, you know the hospital policies and procedures, and you should know the your hospital policies and procedure, like the duty of care responsibilities, who will take the history, and be aware of the potential for conflict of interest, like especially in small communities or within the service settings, and be informed about the elder abuse and engage in training wherever available it is or whenever it is possible. So this is the 5-step approach we have discussed till now. How to respond: identify, then provide the emotional support, assess the risk and plan the safety, whether it is urgent or the non-urgent, and you have to gain the consent. If it is you got the consent, you have to refer to the CMO. If you have not gained the consent, gather the decision making capacity information and document all the concern and response as per your hospital policies and follow-ups. So, nursing assessment, you can see the effect also, hesitant, fearful situations. You can, through observation, keen observation, you can assess all the signs. Sometimes the person you can assess through whether the person is avoiding the talk when you start initiating the talk. They are avoiding or remain silent for long times. Or sometimes they become irritable also. Why you are asking all these questions to us? I'm not feeling any abuse of any kind. So they may say something like this also. So how to identify? Direct questions like the financial abuse, you can directly ask, does your caregiver depend on you for shelter or financial support? Or has money been stolen from you? So these are the direct questions. Are you afraid of anyone at home? Have you been stuck, slapped, or kicked? Have you been tied down or locked in a room? Or has anyone touched you without your permissions? Emotional abuse, like do you ever feel alone? Or have you feel threatened with punishment, deprivation? Have you received the silent treatment? Or have you forced to be fed when you are not being able to, when you don't want to feed or you don't want to have the proper food? So forcefully feeding by the caregiver sometimes, or they may say the rush, they are in rush, so have immediate, right? So what happens when you and your caregiver disagree in any type of the situations? So what to do? Whether you are feeling, so these type of direct questions you can say. So whether they are feeling you are forcefully to accept the answers or accept the decisions what their caregivers are taking. So neglects like, do you lack the aids, eyeglasses, hearing aids, or the dentures? Have you been left alone for a long period of time? If you need assistance, how do you obtain it? When someone nobody is at home, so how do you get help? So these type of questions we can elicit. So when you are communicating with the client, we have to establish a therapeutic relationship, attention to the nonverbal cues we have to give, and interview the client and caregiver separately because they may not feel comfortable in front of the caregivers. So make note of the contradictory statements, right? So in ubiquitous statement like, I don't know if this is a problem for you, but because so many patients are seeing, I see are dealing with abusive relationship, I have start asking the questions in routine. So because there is help available for my patients who are being abused, I now ask everyone about the possibility if it is occurring to them. These type of statement can nurses can give. So direct questions like the physical abuse, anybody threatens you, hurt you, or abuse you, do you feel safe? Or do you feel put down, made fun, or ridiculed by your caregivers? Are you afraid of anyone? So these are the direct questions, examples of the direct questions. Do you feel your caregiver keeps you doing from what you want? Are you made to stay in your room left alone? So, who handles your checkbooks? Does anyone steal money or take things from you forcefully? Or has your caregiver ever refused to help take care of you when you ask for help? So sometimes the caregiver say, I'm very busy, we will talk later on. So these type of therapeutic responses as a nurses we can say that I'm concerned about your safety and well-being, you're not alone, abuse is not your fault. Sometimes the uh, elders feel that it is their fault, they are not being able to cope up with their family, so it is their fault. So you can always assure them it is not their fault, only your abuser have to stop their abusive behaviors, and no one deserve to be abused. There is no excuse for abuses. So there are various screening tools to assess the elder abuse. I'll show you the in the slides like Hochleit's Sengstrup elder abuse screening test, vulnerability abuse screening scales, caregivers abuse screen for elderly, brief abuse screen for elderly, caregiver psychological elder abuse behaviors, older abuse. These are the assessment we have discussed. How we can have the assessment, general assessment, possible abuse indicators, physical abuse, neglect indicators we have discussed in details, possible exploitation indicators also we have discussed like the financial also, abandonment indicators also we have discussed, and we can have the elder assessment in the summarization. We can say that evidence of abuse, whether there is no abuse, evidence, no evidence, possible evidence, probable evidence, definite evidence, and unable to assess. So these type of the assessment scales can be prepared. So nursing actions, how to communicate, like we have to make establish the therapeutic relationships. We have to note the contradictory statements and document. So caregiver indicators, these are the another assessment tool of the caregiver indicators for the caregiver and the care receivers. This is the vulnerability assessment abuse screening scales. Actually, there is a separate session for that, but I have included only the scales which you can use. These are the standardized tools. Assessment tools like the Elder Abuse Suspicion Index tool, easy. Actual abuse tools also examples of the physical, psychological neglect, exploitations, and brief abuse screen for the elder base scales to help practitioner assess the likelihood of abuse. And caregiver abuse screening tools are also been available. These are the again structured tools. HS Elder School, Holex, Sengstake Elder Abuse Screening tests are available. So we can use any of the tools to assess these abuse. Partner violence screening is available. So formal and the caregivers and the informal caregivers, two types of caregivers are over there. Formals are the paid caregivers and the informals are the caregivers. They are not receiving the money that include the family and the friends, right? So role of caregiver is the advisor or the teacher or sponsors or the organizers. So we can assess the various assessments also. Responsibility of the caregiver is a vast responsibility. They have to maintain the healthy environment for the client. So risk factors, sometimes caregiver is not being able to cope up with the situations. So that's why they are not being able to provide the safety of the clients. So various tools are available. So where should be the awareness be highest? Accident emergency rooms. We can look for the emergency rooms, orthopedic units, medicine for the elderly, old age psychiatrist rooms, and the helplines are also available. 15th June is the Elder Abuse World Elder Abuse Awareness Week. Senior citizen apps are available. Helpage India is making a lot of efforts for the to control the abuse. So nurses are the front lines for addressing the elder abuse. They are the frontline staff mandated to report. They can prevent the abuse, and they will have many elderly patients. They are trusted by the patients. They are always caring the client 24/7. So they are trained to care for the whole persons. And preparing the caregiver is the key for the because nurses are in ideal position to prepare the caregiver and identify what resources are needed. So they are also been trained to notice the changes, and they are the first ones to report, like recognizing abuse, risk factors, reporting what we have discussed, documentations also. They can determine any change in conditions, and they are good in picking up the changes and looking for another possible reasons. So they are providing the care, teach the caregivers also, explain the information in a proper manner, communicate the effectively to develop the cost effective plan of cares. So linking caregivers to resources, how they can assist, they provide the guidance, support, and advice to the caregiver and the abusers. Though intervention multi components are over there, comprehensive counseling sessions are over there. They can improve the competence and confidence. They can teach the caregivers how to design. So these are the few examples in the care facilities and the case examples of the abuse reported by nurses. So they have seen the abuse also. So to conclude, the global population ages. It is imperative that nurses have a knowledge base on the topic of the elder abuse. They have a responsibility to identify when abuse may be perpetrated or to assess the context, ensuring the appropriate responses are undertaken. And knowledge of barrier to disclosure is also essential, as well as ensuring that the voice of older person is prioritized in case management. So in doing so, nurses have the ability to prevent and provide early intervention to safeguard older persons. So elder abuse can only be dealt when it is no longer a secret. So, 5 things everyone can do to prevent the elder abuse: listen to elders, educate one another about the sign of the abuse and how to get help, report suspected abuse or neglect as early as possible, and build a community that fosters a social interconnection and support, and reach out to professional services of support wherever available. So take care of the elderly is the prime responsibility. As the Prime Minister Narendra Modi ji has also requested the people of India to take special care of the senior citizens in their family. So with this is a take home message for everyone. So with this, thank you so much for providing me this opportunity to have the session on this elder abuse prevention as part of the nursing perspectives. So Rose, I'm not able
Yeah.
to hear you.
Yeah. Thank you so much, Shanu ma'am. Can you hear me?
Any questions or yes?
Yeah.
Yes, I'm able to hear you.
Okay. Yeah. Actually, it is a very elaborate topic, and you have also covered it like almost I think all the areas you have been touched upon, and very nicely it was explained. And this topic actually, the prevention of elderly abuse is there in all the syllabus also, even in BSc, MSc, or in
Yes.
GNM, in all the syllabus it is there. So it is a very important topic. And I hope all the viewers, they have got adequate information um, about the elderly abuse, and what are the nurses' responsibilities in preventing, and how they should go about in reporting the elderly abuse, and which agencies are there which are taking care about the elderly. So it was a very wonderful session, ma'am.
Thank you so much.
And I'm very thankful to you for sparing your valuable time to spend with us in this webinar as a resource person.
Thank
And
you.
I would also like to express my heartfelt gratitude to our respected principal, sir, Dr. Ravindra Echen, for providing me with this opportunity for being a moderator of this webinar. Thank you, Shanu ma'am, once again.
Thank you so much, all the organizers and your College of Nursing. I'm really highly privileged to have this session on this webinar from the Parul University, Vadodara. Thank you so much, all the organizers and the principals, Madam Rosemary George, and the all the team, IT teams also, and the overall the viewers, our viewers.
Yeah. Thank you
Thank
once
you.
again, ma'am.
Thank you.
Hoping to
Now,
see you in future also.
sure. Same here. Okay, ma'am. Bye.
Okay, okay.
Thanks.
Bye, bye.
Thanks.
Thank you.